Bob loved life. He looked at life as if it were a playground. We were best friends and partners for over 35 years. And this is Bob's sister, Elaine. Bob had frontotemporal dementia, but after Bob became ill, we wanted to still be as full of life as possible. And I just wanted to keep the he of him there. And I think that we did, with the help of everyone at Acadia, Dr. Singer, and all the staff there.
My eating disorder first started spiraling in April of 2019. The first help I received was regular therapy with my therapist, Sarah Porter, at Acadia Hospital. Not only individual therapy at Acadia, but group therapy was huge for me. I'm so thankful for the connections I've made and the services who have helped me to get to where I am today.
Acadia Hospital is loaded with empathy. We're very innovative, we're very creative, and very committed to taking care of our patients wherever they are. A great percentage of our admissions come from the entire state of Maine.
People, when they come, are at a point where they don't know what to do. To be able to offer them a safe space allows them to get their lives back in many ways.
Our patients and our visitors are part of our family. When they come here for services, we're going to do everything we can to help them succeed.
From the minute I walked in there, I had hope for the first time. It was wonderful for Bob because he received respect. He was treated as a person.
The time and the effort they put into me, I felt like I was their most important patient.
Delivering the care here is a total team effort. Every single person in this building has a unique contribution. And when pieces of that are missing, it affects everyone.
At the base of our system, we have some holes. The more we're able to offer, not only at an inpatient, offer those in crisis, but also at a lower level, the stronger our community will be able to be.
Acadia for All is our effort to secure support from the community for advancing the mission of Acadia Hospital.
The Acadia for All campaign has four distinct components. First is the inpatient access aspect of the project, where we're expanding the program to provide more bed capacity for inpatient services. We know that the standard of care is single occupancy rooms. So our plan here with the hospital expansion is to provide 100 beds within our license in single occupancy rooms. It also is better access for a pediatric population. We know that there's an opportunity to improve transportation to our services.
We're also able to create more community spaces so we can do more community work with these kids because the more they work with peers, the more they realize I'm not alone in this.
The kids are getting their therapeutic needs met through general conversation activities and events. So the greenhouse allows us to start our garden season earlier, which allows our school year kids to take a bigger part in it.
Third is our geriatric program, where we have the only mood and memory program in northern New England that is huge demand for that services. We need to expand that service and the research element of that service as well. And last and certainly not least, but thinking to our future, workforce development is a key aspect of this program to be able to attract and retain healthcare service providers that will be here for years to come.
Now is the right time to move forward with this because we have seen, even before the pandemic, that this Maine community has been struggling.
This is a campaign and a fundraiser that is so important to people in this area. They need help, and we need to continue to grow those services.
The relationship with the community is the key to this, and the support from the community is essential.
There's plenty of opportunity for the community to participate in this campaign, whether it's financial support, moral support, or just being open-minded to hear our story.
I wish our community could come in here and see what their contribution does for our patients. To me, it's mind-boggling. They have the potential to change thousands of lives for the better.
I was able to take the worst thing ever in our lives and make it into something with help. What I received, what Bob received, is going to just be multiplied in so many ways by this incredible project.
Building a brighter future for behavioral health care in Maine.
The compassionate care that Maine kids deserve.
Creative solutions for better access to life-changing care.
Empowering every individual to reach their greatest potential.
A team that's by my side every step of the way.
Hope for the present and hope for the future.
That's Acadia for all.
That's Acadia for all.
That's Acadia for all.
That's Acadia for all.